Okay, good evening. So today we will again talk about CBT. Okay, so as in previous video we talked about the codes of the NMC CBT. Okay, so hope you now understand what is the codes and how we can apply it during our work situation. Okay, so wait a second. These are the codes means rules. Okay, so it includes four codes like prioritize people. Okay, make sure you have read all these things and understand what they are trying to say. Okay, and the next code is practice effectively. Read all these things that is in under this practice effectively, all these criteria. Just read it, read for understand. Okay, understand what they are trying to say. Preserve safety, read all these things and just move to the next. And the next last code is it includes four codes: promote professionalism and trust. Just read all these things and just move to the next. So today we will discuss about the next thing, what is after the codes. Okay, so here is the summary NMC CBT code of conduct summary. Here is the summary. These all things that you have already learned in previous codes. They just make short forms. Okay, so you also remember to, this is very important thing to remember, the six fundamental values, also called six C's. Okay, this is a very important thing to remember, is this is called six C's. C's. Okay, the first C is care. Read all these things: care, compassion, commitment, courage, competence, and communication. So make sure to read all these things, and this is very important thing to learn because they most of the time they ask about these things. So you have to remember that these six values you need to remember: care, compassion, commitment, courage, competence, and communication. You have to remember these six things because sometimes in during your exam they will ask you some questions like this: what is not included in six C's, or six fundamental values, or both are the same thing. So in and then they give you four answer options: first, commitment; second, courage; third, confidentiality; fourth, communication. Communication. So look at that, what the question is asking: what is not included in the six fundamental values? It also included, it also included, it also included. This is not included, so this is the correct answer. Confidentiality is not under the six C's. Okay, so that's why I'm saying you need to remember, properly remember the communication, competence, courage, commitment, compassion, and care. Okay, so the next thing is nursing blueprint summary. What it is blueprint summary? As we previously learned, codes are same as rules. Blueprint same as syllabus. What things you need to pass adult CBT? Okay, syllabus. Sorry if more of my spellings, because I'm writing very hurry, so I don't want to make this lecture very big. So domain one. Okay, so nursing blueprint summary. Okay, it include what it is blue what is the meaning of blueprints? The meaning of blueprint is syllabus. Okay, and this syllabus include four domains. What is the meaning of domain? You can remember this like lesson, the same as lesson. Okay, you don't have to waste your time to understand what is the codes, what is the meaning of code, what is the meaning of blueprint, what is the meaning of domain, because it consumes you a lot of time. Just remember these things like this: codes same as rules, blueprint same as syllabus, domain same as lessons. Okay, so in your adult CBT syllabus you have four domains. That means you have four lessons. Domain 1, lesson 1, professional values, the things that includes E, the most important thing. That means you have to remember these things. Okay, so like this. Okay, so you have to remember these things you have to properly read these things. Okay, so it include competencies. Domain 1 include 4 competencies. Okay, 5, 6, 7, 9, 10 competencies. Thus chapter 2, communications and interpersonal skill. The first code was, the first domain was professional values. You have to read all these things like we have learned in the codes, the all these competencies. Okay, all these competencies, communication and interpersonal skill, and learn all these things. Just remember, just read it. You don't have to read it again and again. Just read those things, codes, blueprints and domains two times. Okay, so make sure you understand what they're trying to say. It is not very hard thing, it is very easy. Okay, these all things, don't be afraid of these things, these big paragraphs. Okay, these big paragraphs. So these all paragraphs include very simple and very easy language, very easy information. Okay, so there's a very easy to understand. Domain 3, nursing practice and decision making. How we can make decision in our during nursing, and how we can practice while in hospital, and how we do decision making in the hospital. Okay, so and the communication and interpersonal skills. So what that means, how you can communicate with the patient, how you use your interpersonal skills to provide the best care to the patient. These are things just includes these. Okay, these are all the professional values, just professional values that that you should have to maintain while you are working in the hospital. Okay, these are totally simple things, very simple things, I can't say that. And okay, very simple things, I can say that. The domain 4 is leadership, how you lead the team in some cases, when in some cases in emergency situation, if you have to lead the team, so what leadership skills that you should have. These things, leadership. Management, how you manage your time, how you manage your work, how you manage your uh, any things during your work. And teamwork, they also, this is a very important thing to learn, teamwork. Okay, just that these things, just that's it. Okay, don't forget to read the e things. Okay, there's a very important things. E means essential, very important. Okay, just read these things also. Okay, field, what is the meaning of this? Field specific competency, that means if you are, this is only for adult nursing exam. If you are going for adult nursing, so this is the field specific and competencies. What things you also have to remember to pass the exam, these things also you will like this. Okay, you should have to read these things as well to pass your adult nursing exam. Okay, field, these all for adult nursing. Okay, if you are going for mental health nurse, so in some another PDF, you have to write field specific competencies in mental health nursing, in child health nursing. But this is for adult nursing, so this is also the type of syllabus, we can say that. So you should have to read this. Okay, so don't worry, this is very simple things. Before your exam, I would highly recommend to you, please read all these things. Okay, so after, in next video we will discuss about role marks and manual of clinical nursing. Okay, so first, in that thing, the what is the what things you have to remember. Okay, so first, codes means rules. Second is blueprints, what we have learned in this section. Blueprints means syllabus. Third, we learns domains under blueprints means same as lessons. And then we learn about field specific competency, adult nursing. It includes sections, so please make sure read all these things, including codes, blueprints and domains and sections 1 to 3 times, so you can easily understand the information what they have written in these things. Okay, so this is the very important things that you should have to learn. Okay, so take care for now. In any, if you have any inquiry, please, you can join OET Talks Telegram and YouTube channel. Okay, in any inquiry, if you want to learn OET and CBT exam, so you just search OET Talks on Telegram and YouTube, so you will get our channel or our Telegram group. So if you need any help, you just comment on our videos, or you can join our Telegram channel and ask the question in that, because this is a group, this is our OET Telegram group is a free for public. Okay, so anyone can write a message in that group, so that's why I'm recommend to you, join that group, so you can get the answer of your question as easy as you can, as fast as you can. So take care for now, let's meet in the next video.